Hey guys, welcome back to ZMed. In this video, we're breaking down ADHD, what it is, how common it is, the differences between males and females, and the main causes and risk factors. We'll also look at real-world clinical cases. And here's a little bit of a twist. I'll reveal the answer at the end of the video. And in the next video, I'll walk you through the full explanation step by step. So we'll use an MRCPsych-style question that I wrote myself. I'll reveal the answer at the end of the video, and the full explanation will be in the next video, inshallah. So here's the question. A 10-year-old boy has a confirmed diagnosis of ADHD. He's noted to be distractible, forgetful, and often interrupts others. So just look at the key words. Forgetful, fidgety, and often interrupts others, and is distractible. These difficulties have been observed both at home and at school. So they've been observed in two places and have persisted for more than a year. First becoming apparent in the early years of primary education. So these things have been happening, these symptoms been occurring in early years of primary education. According to DSM-5 diagnostic criteria, which additional feature must be present for the diagnosis of ADHD to be made? A. IQ below 70. B. Symptoms present before the age of 12. C. Symptoms occurring only in the school environment. D. Use of stimulant medication for at least 6 months. E. Presence of comorbid conduct disorder. Now note down the key words I have underlined, and you'll find out the clue and the answer through that. And also use your own clinical reasoning. I'll give the answer at the end of this video and the step-by-step explanation in the next one. So, ADHD, what does it stand for? Attention Deficit Hyperactivity Disorder. So what is ADHD? What is ADHD? It is a neurodevelopmental disorder. A neurodevelopmental disorder. Here's one way I like to learn it. It's a mnemonic I use. And this is found in DSM-5. PIA. Pakistani International Airlines. So, what does it stand for, PIA? Persistent inattention and or hyperactivity impulsivity, which interferes with daily functioning and development. So just to repeat, ADHD is a neurodevelopmental disorder. It's a neurodevelopmental disorder where there is a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development, as characterized by the following, which we will discuss later on. So just for you to remember, the mnemonic is Pakistan International Airlines. For P for persistent, I for inattention, and the attention part is airlines. Then here is the graphic for that you can remember. The hyperactivity impulsivity, you could remember that by a man at the front of the plane saying hi and then the plane PIA, Pakistan International Airlines. You could take a screenshot of that, pause the video, and take a screenshot. So, what do we mean by persistent? So the symptoms they last at least 6 months across 2 or more settings. So for example, in school or at home. Now, the inattention, this means things like making careless mistakes, difficulty sustaining focus, you have decrease in focus, you won't be able to sustain it. Forgetfulness, and they're easily distracted. The hyperactivity impulsivity, let me branch it out like this, and that involves fidgeting a lot, talking excessively, interrupting people whilst they are speaking, and acting without thinking. Acting without thinking. So just to repeat that hyperactivity impulsivity means that they're fidgeting more, they're talking more, they're interrupting more, and they're acting without thinking. You can take another screenshot of that, pause the video and take a screenshot. Remember, the definition that we discussed back here, a persistent pattern of inattention and hyperactivity impulsivity that interferes with functioning or development. This definition is discussed in DSM-5, pages number 59 to 60. Remember that. I'll stop the video right there. If I missed anything important, I'll make sure to include it in the next video, inshallah, where we'll keep building on this series step by step, and we'll include things like pathophysiology, clinical features, diagnostics, diagnostic criteria, treatment, management, prognosis, whatnot. And I haven't forgotten about the MRCPsych-style question right here that I'm just presenting. You can have another look at it. You can pause the video to answer the question, but the answer is B. Symptoms present before age of 12. And the clue in this is the last sentence, early years of primary education. We'll discuss this further in the next video. Thank you for watching ZMed. If you found this video helpful, don't forget to like, subscribe, and share the video with friends and family. This is Dr. Zarar from ZMed, and I'll see you in the next video. There's a bit of a preview of the video at the below if you noticed. That will be Z-Med out.
يا دعاء